guys, good morning. And today I will be discussing the infectious skin disease. And let us start with our skin. So we all know that our skin is our biggest organ in our body, and it protects us from, the dirt, the bacteria. Yeah. And so let us start with epidermis. So epidermis, it is the superficial portion of the skin. This is the epidermis. And then, next one is dermis. It is the inner layer of skin containing blood and lymphatic vessels, nerve endings, glands, and hair follicles. Okay. And then, next, dermatitis. It is the inflammation of the skin. And then, next, sebaceous glands. Glands in the dermis that usually open into hair follicles and secrete an oily substance known as sebum. So, I think this is the sebaceous gland. Yeah, kung saan tumutubo yung hair natin. And it produces oil, which is the sebum. So, di ba minsan parang naglalagkit-lagkit tayo? So, that's the sebum that we are producing. Okay, next is the folliculitis. Inflammation of a hair follicle, the sac that contains a hair shaft. Next, stye. Inflammation of the sebaceous gland that opens into a follicle of an eyelash. Next is furuncle. A localized pyogenic pus producing infection of the skin, usually resulting folliculitis, also known as a boil. So, yung furuncle, parang, nag-result siya sa boil. Okay. Next, carbuncle. Hindi ko kung paano i-pronounce. Parang a deep-seated pyogenic infection of the skin, usually arising from a coalescence of furuncles. Next, macule. A surface lesion that is neither raised nor depressed, such as the lesions of measles. Papule. A surface lesion that is firm and raised, such as lesions of chickenpox. Next, vesicle, a blister or small fluid-filled sac such as is seen in chickenpox and shingles. So, yung mga lesion, yung macule, parang parang rashes sa skin, na parang buo-buo. Tapos yung papule naman, parang siyang nakaupok sa skin natin. Yun, parang may mass sa loob. Okay, next. Yung vesicle naman, yun yung parang may tubig-tubig sa loob. Diba, kanyari, meron tayong, ano ang example? May tumubo sa chin natin. Tapos, yung itsura niya, parang siyang may tubig sa loob. Tapos, diba, pinuputok natin yun, pero dapat din natin pinuputok. Yun yung vesicle. Next, viral infections of the skin. Yun yung mga viral infections of the skin. So, what is a skin infection? Your skin is the largest organ of your body. Diba? As sinabi ko kanina. Its function is to protect your body from infections, and sometimes the skin itself becomes infected. Skin infections are caused by a wide variety of germs, and symptoms can vary from mild to serious. Some infections may be treatable with over-the-counter medications and home remedies, whereas other infections may require medical attention. So let's start with chickenpox, or also known as varicella. Chickenpox is a very contagious infection caused by the varicella zoster virus, and it mainly affects kids, pero pwede din magkaroon ng adults nito. Actually, ang sabi nila, pag daw nagkaroon ka lang nito ng isang beses, hindi ka daw nagkakaroon. Yan. And then, yung chickenpox, sobrang itchy nito, sobrang red, tapos magkakaroon ka ng blisters, skin rash. Pero, mga ilang days lang din siya, tapos parang magpa-pop na yun, tapos magli-leak. Yan. Tapos yun, mag-heal na siya pag dry na. And then, yung treatments naman nito, actually parang wala naman. Pero, bibigyan lang ng antihistamine yung mga bata. para hindi sila makate. Yun. Next, German measles or rubella. German measles, also known as rubella, is a viral infection that causes a red rash on the body. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. The infection can spread from person to person through contact with droplets from an infected person's sneeze or cough. Okay, so itong German measles, yung lesion niya, hindi siya masyado katulad ng measles mismo. Kasi ito hindi siya red masyado. Katulad ng measles talaga. Okay, so paano i-treat tong German measles? Most cases of German measles are treated at home. Your doctor may tell you to rest in bed and to take acetaminophen, which can help relieve discomfort from fever and aches. They may also recommend that you stay home from work or school to prevent spreading the virus to others. Okay, next, measles. Heart measles or rubeola. Diba yung isa, yung German measles, rubella. Ito naman, ang measles, rubeola. An acute, highly contagious viral disease with fever, runny nose, cough, red eyes, and spreading skin rash. The 8-day measles is the ordinary measles, also known as rubeola, a potentially disastrous disease. Sorry. So, ang treatment nito, fever reducers. Kasi, pwedeng ikaw na nagbabantay, pati yung merong measles, ang uminom nun para hindi ka mahawa. Tapos, ang mga pwede nyong inumin, ibuprofen, which are, kunyari, Advil, children's Mortrin, and others. Yan. Para wala yung mga fever. Next, smallpox. It is a systematic viral infection with fever, malaise, headache, prostration, severe backache, a characteristic skin rash, and occasional abdominal pain and vomiting. The rash is similar to and must be distinguished from the rash of chickenpox. Smallpox can become severe with bleeding in the skin and mucous membranes followed by death. So, ito parang mostly sa mga babies din to. Itong smallpox kasi wala tong cure, unlike yung chickenpox mismo. And, kailangan ng vaccine ito. I mean, parang chickenpox din mo kailangan ng vaccine. Pero, ayan. Next, 3 types of warts. Plantar warts, genital warts, and flatwarts. Warts consist of many varieties of skin and mucous membrane lesions, including common warts, which are verrucae vulgaris, venereal warts, and plantar warts. Most are harmless, but some can become cancerous. So, ang treatment nitong warts, pwede kang maglagay ng mga gels, pads, and plasters. They are designed for application to many types of warts, from tiny ones to larger ones. Salicylic acid is a keratolytic medication, which means it dissolves skin protein, or keratin, which makes up most of the mass of the wart, and the thick layer of dead skin that often surmounts it. Next, bacterial infection of the skin. So, bacterial infections are common even though the skin forms such as an effective barrier that people may constantly come into contact with bacteria without skin problems occurring. So, any breaks in the skin makes it more likely for bacterial disease to establish itself. So, it is important to keep cuts and scrapes clean and covered. Infectious skin diseases are also more prevalent in those people with suppressed immune systems or with conditions such as diabetes, where circulation is impaired. So, unang-una ng skin infection natin is acne. Ito very common to sa atin, lalo na sa mga teenagers na So, ito. Acne is a common condition in which pores become clogged with dry sebum. leaks skin and bacteria, which leads to the formation of blackheads and whiteheads, collectively known as acne, pimples, and inflamed infected abscesses. Acne is most common among teenagers, di ba? Sabi ko kanina. So, para matreat to, usually the first choice of treating acne is tetracycline, such as minocycline or doxycycline, or a macrolide. Oral antibiotics should be used for the shortest time possible to prevent antibiotic resistance. Antibiotics are best used with topical retinoids and benzoyl peroxide. Okay, so next, anthrax. Anthrax, also known as a wool sorter's disease, can affect the skin, lungs, or gastrointestinal tract, depending on the portal of entry of the etiologic agent. Okay, so yun yung anthrax. Tapos, ang treatment na to, doctors have several options for treating patients with anthrax, including antibiotics and antitoxins. Patients with serious cases of anthrax will need to be hospitalized. They may require aggressive treatment such as continuous fluid drainage and help breathing through mechanical ventilation. Next, ito, gas gangrene or clostridial gas gangrene is a life-threatening necrotizing soft tissue infection commonly caused by the rapid proliferation and spread of Clostridium perfringens from a contaminated wound. So, ayun. Makikita niyo sa pictures, tingnan niyo yung PowerPoint kung ano yung itsura niya. So, pag daw nakita na yung parang may signs ka ng gas gangrene, kailangan mong i-treat yun agad-agad. So, ang treatment nun is high dose of antibiotics, typically penicillin and clindamycin are given, and all that infected tissue is removed surgically. About one of 5 people with gas gangrene indeed requires amputation. So, yun nga, pag hindi naagapan tong gas gangrene, pwedeng putulin. Sabi ko na yung paan. Yun, puputulin para hindi na mag-spread sa katawan natin. Next is leprosy is today more commonly known as Hansen disease. There are 2 forms of leprosy, lepromatous leprosy, and it is characterized by numerous nodules in skin and possible involvement of the nasal mucosa and eyes. And yung pangalawa naman, tubercular leprosy, in which relatively few skin lesions occur. So, ang treatment nito ay combination of antibiotics. 2 to 3 antibiotics are used at the same time. These are dapsone with rifampicin and clofazimizin. It's added for some types of diseases. This is called multi-drug therapy. Okay, next. Staphylococcal skin infection. Okay, so virtually all infected hair follicles or balls, carbuncles, and styes involve Staphylococcus aureus. The majority of the common lesions are localized, discrete, and complicated. However, bleeding of the bloodstream may lead to pneumonia, lung abscess, osteomyelitis, sepsis, endocarditis, meningitis, or brain abscess. With impetigo, which occurs mainly in the children, pus-filled blisters, or pustules, may appear anywhere on the body. Okay. So, yun nga guys, pag tingnan niyo yung PowerPoint, makikita niyo kung anong itsura niya. Okay, papakita ko. In case, you can manood. Yan. Okay, next. Ano daw yung treatment sa staph infection? So, yung mga minor skin infections are usually treated with an antibiotic ointment, such as non-prescription multiple antibiotic mixture. In some cases, oral antibiotics may be given for skin infections. Additionally, if abscesses are present, they are surgically drained. So, medyo delikado pag meron ng abscess kasi kailangan nyo tanggalin agad surgically o operahan. And more serious and life-threatening infections are treated with intravenous antibiotics and supportive medical care in the hospital. So, yun. Next, streptococcal skin infections. Ito, impetigo, number 1. Streptococcal impetigo is usually superficial but may proceed through vesicular, pustular, or encrusted stages. Next, scarlet fever, an infectious bacterial disease affecting especially children and causing fever and scarlet rash. It is caused by streptococcus. Next, erysipelas. Erysipelas, also known as St. Anthony's fire, is a relatively common bacterial infection of the superficial layer of the skin. Extending to be superficial lymphatic vessels within the skin, characterized by a raised, well-defined, tender, bright red rash typically on the face or legs, but can occur anywhere in skin. Next, necrotizing fasciitis, an acute disease in which inflammation of the fasciae of muscles or other organs results in rapid destruction of overlying tissues. Next, ang treatment daw nito ay flacloxacillin. Is more appropriate than simple penicillin, as it treats both staphylococcus or staph and strep. If the laboratory has confirmed streptococcal infection, then the most appropriate antibiotic is usually penicillin. Next, okay, naman tayo sa fungal infection. So, pwede daw siyang ma-classified as superficial mycosis. Ito naman yung fungal infections of the outermost areas of the body, including the fungal pathogens cause disease by invasion and mechanical destruction of tissues and obstruction of the flow of the body fluids. Okay, so yung isang type naman, subcutaneous mycosis. Ito naman yung mga fungal infections of the dermis and underlying tissues. They are more severe than superficial and cutaneous mycosis. Example ng mga to ay sporotrichosis and choromomycosis. Wait lang, chromomycosis. Sorry. Okay, so ito na yung mga various type of tinea infection. Tinea pedis, ito athlete's foot. And it usually occurs sa may gitna ng toes natin. Diba? Kunyari ito yung toes dito. Tapos, nangyayari ito common sa mga taong mapawisin yung mga paa. Tapos, pag nagsusuot ng mga mahigpit na sapatos. So, ang signs nito ay, yun nga, may rashes, makate, tapos, minsan parang mahapde, tapos, burning din. So, ang tinea pedis can be treated with topical or oral antifungals or combination of both. So, iinumin mo yun 1 to 6 weeks or depende gaano kalala ng athlete's foot. Tapos pwede din mag-apply ng cream twice a week. Yung mali pala is applied once daily for 2 weeks. Sorry guys. Okay, so ang tinea corpis naman, tinea corpis is a fungal infection that develops on the superficial layer of the skin. It can occur in any part of the body part, but it is common in the legs and arms. So parang lagi tayo nagkakaroon ng ganito sa legs and arms, and particularly particularly sa mga glabrous skin. Tinea corporis is commonly called ringworm, although this skin condition is misnomer. It otherwise got the name ringworm due to its appearance similar. Another term for tinea corporis is tinea glabrosa and tinea circinata. Next, the treatment of tinea corporis is mostly through topical therapy as dermatophyte infections seldom reaches the deeper tissues of the body. It is mostly superficial. The topical antifungal is enough to treat the skin condition. The antifungal cream is usually applied twice a day for a period of 2 weeks or depending on the agent being used for treatment. The usual antifungal treatment for tinea corporis includes the following: topical azoles, imidazole topical cream, allylamine pudding, benzylamine butenafil. Grabe kasi, ma'am. Okay, so oral antifungal medications are given when tinea corporis remains unresponsive to a topical therapy. Intensive care of tinea corporis is treated with topical therapy combined with oral antifungal medication, usually over the course of 1 week. Next is tinea capitis. Ringworm of the scalp is a fungal infection of the scalp and hair shafts. The signs and symptoms of ringworm of the scalp may vary, but it usually appears as itchy, scaly, bald patches on the skin. So, yung mga oral antifungals are needed to effectively treat tinea capitis. Terbinafine, itraconazole, and fluconazole are the perfect agents for tinea capitis. Tinea cruris. Tinea cruris is the name used for infection of the groin with a dermatophyte fungus. It is most often seen in adults and sa mga lalaki. Tinea cruris is commonly known as jock itch. Tinea cruris is usually treated with topical antifungal agents. Sometimes hydrocortisone is added for faster relief of itch. So, topical steroids should not be used on their own. If the treatment is unsuccessful, oral antifungal medicines may be considered, including terbinafine and itraconazole. So, that's it for today, guys. Yeah, sorry guys, medyo mahirap kasi mga words.
So, today I will be discussing about the infectious diseases of the ear. There are actually 3 pathways that pathogens can enter our ear: through the eustachian tube, from the throat and nasopharynx, from the external ear, and via the blood or lymph. So, the eustachian tube is a small diagonal tube that connects from the middle ear to the back of the throat. It regulates the air pressure and air supply in the middle ear, and this is also where the middle ear secretions drains. So, when bacterial infection, swollen lymphoids or adenoids, allergies, or viral infections are present in the throat and nasopharynx, this usually forces the eustachian tubes to close. Bale dun sa sinabi ko kanina about sa sa functions niya. This usually traps the fluids or secretions of the middle ear within the middle ear, and there is also no regulation of air pressure and air supply in the middle ear. This results to an anaerobic environment, which allows anaerobes to multiply and cause pressure to the eardrums. This is where the infection kicks in sa tenga natin. So, the infection of the middle ear is called otitis media. Meanwhile, infection of the outer ear canal is called otitis externa. So, simulan natin siya sa otitis media. Otitis media is a group of inflammatory diseases in the ear. It is usually divided into 2 groups: AOM, which is acute otitis media, and OME, otitis media with effusion. So, what is otitis media? Otitis media is an infection of the middle ear. This can be acute or chronic. Children are most affected by this because it is induced by colds and blocked eustachian tubes, both typical ailments of childhood. Why blocked eustachian tubes are typical ailments of a child? Because the anatomical structure of a eustachian tube when you are a child is placed horizontal, while if you're an adult, your eustachian tubes is usually diagonal, but for children it is horizontal, so it is easily blocked by the secretions or anything else that's passing through it. The infectious agents can be either viral or bacterial, but most cases that has been researched, it is caused by viruses. Let's move on to AOM, or acute otitis media. AOM is the most common and least serious form of ear infection. The middle ear becomes infected and swollen, and fluid is trapped behind the eardrum. There can also be occurrences of fever when you have AOM. OME, otitis media with effusion. After an ear infection has run its course, there may be some fluid left behind the eardrum. Usually, a person with OME may not feel or experience symptoms, but a doctor will be able to spot the remaining fluid behind the eardrums. Otitis externa, an infection or inflammation of the ear canal between the eardrum and the outer ear. This is usually triggered by exposure to dirty water or mechanical damage due to overzealous cleaning. This is also known as swimmer's ear. So the infectious agents can be fungal or bacterial. And for treatments of otitis media and externa, treatments usually for infants 6 months of age, prescription of antibiotics such as amoxicillin help prevent the spread of infection. For 6 months to 2 years old, they shall be under monitoring without antibiotics. It is the course of treatment unless the infection in the ear is severe. Due to that, overuse of antibiotics will lead to antibiotic resistance. This will make the infection harder to treat. Also, that ear infections usually clears up without antibiotics. The only necessary medications are for pain management, and usually antibiotics are only used when the case is severe and prolonged. It is also said that the AAFP, or the American Academy of Family Physicians, said to be watchful for children aged 6 to 24 months above experiencing mild middle ear pain on either one or both ears with 39 degrees Celsius of fever or less in less than 48 hours. Warm compress also helps on soothing the affected ear. But with recurring infections for months of years, this usually calls for myringotomy. The surgery will make a small cut in the ear, allowing the release of built-up fluid. Also, a myringotomy tube will be inserted in the middle ear, allowing air to prevent further fluid build-up. This will be left in the ear for 6 to 12 months, but it naturally falls out, so it doesn't have to be manually removed. Next is the serous otitis media. This is also known as glue ear. Children aged 6 months to 2 years is vulnerable to this infection. This commonly develops after a middle ear infection. So, it is characterized by build-up of fluid and pus within the middle ear. The causative agents were usually viral and bacterial. The treatments are antibiotics, but if antibiotics fail and the glue ear is it keeps on recurring. Surgery is needed. They will be inserting small drainage tubes called grommets. Next is infectious myringitis. It is the inflammation of the eardrum. It is caused by infection from either viruses or bacteria. The eardrum responds to the inflammation by forming blisters on the eardrum, and that is quite painful. If infectious myringitis is accompanied by fever, the infection agent is possibly bacteria. So the treatments usually is antibiotics and pain relieving medications, and professional rupturing of the blisters. And that sums up for my report, infectious diseases of the ear. Thank you.
Good day, everyone. So, I will discuss the infectious diseases of the eyes. So, here's our presentation made by Ariza Ensunga and Angeline P. Vicente from BSM 1A. So, eye infection, if you've noticed some pain, swelling, itching, or redness in your eye, you likely have an eye infection. Three specific categories based on their cause: viral, bacterial, or fungal. But, in additional, any of the various parts of the eye can be infected. Kumbaga sa mga parts ng eye natin pwedeng ma-infect. Number 1, ito yung tinatawag na talukap ng ating mata, eyelids, no? And tissue surrounding the eyes. Pangalawa, the conjunctiva. So yung function naman nito is keeping the front surface of the eye moist and lubricated, protecting the eye from the dust. No, it is a loose connective tissue that covers the surface of the eyeball. And pangatlo, the cornea, the clear dome-shaped window of the front of your eyes. It focuses light into your eye. So lastly, the intraocular area, each of these area can be infected. So, sa mga susunod o tatalakayin natin for, ayan, sa araw na ito, o gabi man sa inyo, tatalakayin natin is yung mga diseases na pwedeng magkaroon yung mga mata natin o mga mata ninyo. So, ayun, keep watching and keep listening kasi mahalaga din ang pakikinig at para matuto tayong lahat. So, ayun lang. Okay, number 1, conjunctivitis or pink eye we called. It happens when blood vessels in conjunctiva become infected by bacteria or virus. So, this kind of disease can be viral, can be in bacteria or fungal. So, if it is bacterial conjunctivitis, is a common type of pink eye caused by bacteria that infect the eye through various sources of contamination. So, nangyayari to kapag na-contaminate yung mata natin, no? The bacteria can be spread through contact with an infected individual, exposure to contaminated surfaces, or through others means such as sinus or ear infections. So, in viral conjunctivitis, it is a highly contagious acute conjunctiva infection, usually caused by adenovirus. Yung symptoms nito is, yun nga, irritation, photophobia, and watery discharge. So, now, I will show you a person having conjunctivitis. So, here's one. So, the symptoms of this disease, reddish or pinkish tint to your eye. Yan. Watery discharge from your eyes that thickest when you wake up. Itchiness or feeling like there's something constantly in your eyes. Producing more tears than usual, especially in only one eye. So, if you're asking what treatment that will you have if you are having this kind of disease, so here's the treatment that you can have. If this disease is bacterial, you can have antibiotic eye drops, ointments, or oral medications to help kill bacteria in your eyes. So if it is viral, no treatment exists, no. Symptoms tend to fade after 7 to 10 days. Apply a clean, warm, wet cloth to your eye to relieve discomfort. Wash hand frequently, avoid contact with others. So, if yung disease na meron ka is viral, maging aware ka din sa lahat ng kilos mo. Dapat lagi kang nakasanitize, no? Iwasan mo din naman magkaroon ng contact sa ibang tao. Ikaw na rin mismo mag sa sarili mo na ganun ang gawin, no? So, if it is allergic, you can have naman over-the-counter or OTC antihistamines like diphenhydramine or loratadine help relieve all allergy symptoms. So, number 2, keratitis. It happens when your cornea gets infected. Results from either an infection, bacterial, viral, fungal, or parasitic, or an eye injury. When we say bacterial keratitis, no, it is an infection of the cornea that is caused by bacteria. It can affect contact lens wearers and also sometimes people who do not wear contact lenses. So when we say fungal keratitis, it is an infection of the cornea that is caused by a fungus. And when we say viral keratitis, it is a common infection of the cornea and not always associated with contact lens use. Before I proceed in showing you the image of a person having keratitis, I will show you the difference of bacterial conjunctivitis versus viral conjunctivitis. Here's the symptoms of having keratitis: redness and swelling in your eye pain or discomfort, producing tears than usual or abnormal discharge, loss of some vision or blurry vision, light sensitivity, sensation of having something stuck in your eye. So here's some info if you're more likely to develop keratitis if you wear contact lenses. Yan, sa mga madalas po na magsuot ng contact lens. Dapat maging responsible kayo to use that. Your immune system is weak from another condition or illness. You live somewhere that's humid and warm. You use corticosteroid eye drops for existing eye condition. Your eye is injured, especially by plants with chemicals that can get into your eye. So here's the treatments that can be used sa mga taong merong keratitis. So if it is bacterial keratitis, ito yung mga kailangan. Antibacterial eye drops usually clear up keratitis in few days. Oral antibiotics for severe condition. If fungal, antifungal eye drops to kill fungal organisms causing keratitis can take weeks to months. If this is viral, there's no way to eliminate the virus. Oral antiviral medications or eye drops can help stop the infections few days to week but may return later even with treatment. Third one, the endophthalmitis. It is severe inflammation of the inside of your eye resulting from a bacterial or fungal infection. Candida fungal infections are the most common cause of endophthalmitis. Now, it may happen after eye cataract surgery, although is rare. Also happen when eye is penetrated by an object. So now I will show you the image of a person of having endophthalmitis. Yan. So, yan po. So, here's the symptoms of having endophthalmitis. Mild to severe eye pain, blurry vision, and partial or complete vision loss. So, yan, may mga times talaga na ano ka na nito, blurry na yung paningin mo. May times din naman na yung paningin mo bigla ka na lang nabulag, ganon. Redness or swelling around the eye. So, nakita nyo naman kanina, ayan o. Yan, redness na yung paligid nung eye. And eye pus or discharge, na may nana na din daw. Sensitivity to bright lights. So, how you treat this one? So, here's the information. Antibiotic injected directly into your eyes and corticosteroid shot. So, eto na yung i-injectan ka, no? If something has gotten into your eye and caused infection, you will need to get it removed right away. Seek for emergency medical attention in these cases. Never try to remove an object from your eye by yourself. After antibiotic and object removal, your symptoms can begin to get better in few days. For number 4, blepharitis. So, it is an inflammation of your eyelid, the skin fold covering your eyes, caused by clogging of oil gland inside the eyelid skin and may be caused by bacteria. So, bacteria blepharitis, common eye disorder caused by either bacteria or a skin condition such as dandruff of the scalp or rosacea. So, here's the image of a person having blepharitis. Yan, so makikita mo naman yung eyelid niya, no? Yan, may diferensya na. Symptoms of blepharitis, yan. Eye or eyelid redness, itchiness, swelling. So, ito na yung point na kung saan yung eyelid mo turns into redness and nangangate, namamaga. No? Eyelid oiliness, sensation of burning in your eyes, feeling like something stuck in your eye, sensitivity to light, producing tears than usual, crustiness on your eyelashes or corners of your eye. So, here's some info if you are more likely to develop blepharitis. If you have scalp or eyebrow dandruff, are allergic to your eye or face makeup, have oil glands that don't work properly, have mites or lice on your eyelashes. So, ito yung parang meron ka ng mga lisa-lisa dyan sa eyelashes mo. Take certain medications that affect your immune system. So, here's the treatments if you are having blepharitis. Cleaning your eyelids with clean water and applying warm, wet, clean towel to your eyelids to relieve swelling. Using corticosteroid eye drops or ointments to help with inflammation. Yun nga, sa paggamit ng ointments. Using lubricating eye drops to moisten your eyes and prevent irritation from dryness. Taking antibiotics as oral medication. Eye drops or ointments applied to your eyelids. So, for the 5th one, stye, also called the hordeolum, pimple-like bump that develops from an oil gland on the outer edges of your eyelids. Glands can get clogged with dead skin, oils, and other matter and allow bacteria over in your glands. So, this kind of disease is just like blepharitis, which is sa eyelids din, no? It looks like a pimple kasi may fuzz siya, no? May nana din. Then, ayun. So, I will show you in the next slide the image of a person having stye. So, here's the symptoms of having stye. Pain or tenderness, itchiness or irritation, swelling, producing more tears than usual, crustiness around your eyelid, increased tear production. So, in the next slide, I will show you naman kung anong treatment ang pwedeng gawin if you're having stye. So, ayan, applying clean, warm, damp cloth to your eyelids for 20 minutes at a few times a day. No, using mild scent-free soap and water to clean your eyelids. Taking over-the-counter, OTC, pain relievers, such as acetaminophen or Tylenol to help pain and swelling. So, ito yung mga pain relievers, no, na matatawag na para makapag-ease ng pain, tsaka lalo na ng pamamaga ng eye na merong sty. Stopping use of contact lenses or eye makeup until the infection goes away. So, kapag meron ka nito, syempre, iwasan mo muna mag-wear ng contact lens, no, at tsaka, iwasan mo muna mag-eyeshadow, no, for a while. At the same time, yan, mag-makeup, ano mo muna sarili mo na maging fresh yung mukha mo. And for the last, using antibiotic ointments to help kill the infectious overgrowth. So yan, mahalaga talaga yung antibiotics kasi sila yung number 1 na panlaban sa mga ganitong klaseng sakit. For number 6, uveitis, it happens when your uvea gets inflamed from infection. Uvea is the central layer of your eyeball to transport blood to your retina, the part of your eye that transmit images to your brain. For the second point, results from immune system conditions, viral infections, or eye injuries. Doesn't usually cause long-term problems, but you can lose vision if a severe case isn't treated. So, yung uveitis daw is kapag namamaga or namumula yung uvea dahil sa infection. So, here's the image of a person having uveitis. Na po? Symptoms of having uveitis: eye redness, pain, floaters in your visual field, sensitivity to light, blurry vision. Here's the treatments of a person having uveitis: wearing darkened eyeglasses, eye drops that open up your pupil to relieve pain. Yan, so eye drops pa din, no. Corticosteroid eye drops or oral steroids that relieve inflammation, eye injections to treat symptoms, oral antibiotics for infections that have spread beyond your eye, medications that subdue your immune system. For number 8, ocular herpes, it happens when your eye is infected by the herpes simplex virus, HSV-10. Yan. For the second point, spread by contact with someone who has an active HSV-1 infection, not through sexual contact. That's HSV-2. So, when we say HSV-1 infection, yan yung herpes simplex virus 1. It is a highly, type 1 pala siya. Herpes simplex virus type 1 infection. It is a highly contagious infection that is common and endemic throughout the world. Most HSV type 1 infections are acquired during childhood and infection is lifelong. The vast majority of HSV-1 infections are oral herpes. Yan. Infections in or around the mouth, sometimes called oral labial, or oral facial herpes. But a proportion of HSV type 1 infections are genital herpes, infections in the genital or anal area. So, here's the image of a child having ocular herpes. So, here's the symptoms of ocular herpes: eye pain and irritation of the eye, sensitivity to light, blurry vision, eye tissue or corneal tears, thick watery discharge, eyelid inflammation. Ano po? So, the treatments, yan, for the first point, antiviral medication such as acyclovir or Sovirax, as eye drops, oral medications, or topical ointments. Debridement or brushing off your cornea with cotton to get rid of infected cells. Corticosteroid eye drops to relieve inflammation if infection spreads farther into your eye, the stroma. Number 7, cellulitis. Yan. Happens when eye tissues get infected, often caused by an injury like scratch to your eye tissues that introduces infectious bacteria, such as Staphylococcus or Staph, that is a group of bacteria that can cause a number of infectious diseases in various tissues of body. No. So, ayan po, young children are more likely to get cellulitis because they are at higher risk of infection due to the type of bacteria that causes this condition. So, more likely, young children, yan, na nakakakuha ng cellulitis. No, because they are high risk sa ganitong infection. No. So, here's a picture of young children having cellulitis. So, so, here's the symptoms of having cellulitis. Include eyelid redness and swelling. So, yun, makikita nyo po, namumula, parang namumutok-mutok na yung mata, as well as eye skin swelling. You typically won't have any eye pain or discomfort. No. So, here's the treatment. Just like the other, just like sty, no? Ito yung mga treatment. Yan. Uveitis, blepharitis. Applying a warm, damp, clean towel to your eye for 20 minutes at a time to relieve inflammation. Taking oral antibiotics such as amoxicillin or IV antibiotics for children under 4. Getting surgery to relieve pressure within your eye if the infection becomes very severe. And now, I am done to present with you the 8 diseases. So, before I end this video, I would like to share with you these tips, no, to prevent eye infections. Always use the following that I will say with you. First point, yan, always remember this, avoid touching your eyes directly. No, so kasi, may mga times talaga na madumi yung hand natin, but because tinuturuan tayo, dapat tayo ay matutong sumunod. Because yun nga sabi, prevention is better than cure. So, hugas lang naman ng kamay, mag-hand washing ka, hindi naman masama, no? Hindi naman yung pagiging maarte. Pero, kundi, iniingatan lang natin yung kalusugan na meron tayo. So, in the second point, yun nga, wash your hands frequently, especially after touching dirty surfaces. In the third point, yan, sa mga contact lenses wearers, no, always clean them and store them correctly. And for the last one, avoid sharing eye makeup or makeup brushes with others. So, yun nga, madalas, lalo na sa mga nagpa-pageant, lalo na yung mga may hair and makeup stylist, no, i-remind nyo sila na laging mag-sanitize ng mga brushes nila kung ginagamit ito sa inyo at sa iba pang tao. So, ayun lang. Ayan, when to see a doctor daw? Yan. If you suspect that you have an eye infection, it's always best to contact a doctor. So, hindi masama na magpa-doktor. So, kung ikaw ay takot na magpa-check up sa doctor, wag. Kasi mas maganda na maagapan yung sakit na meron ka. O kung yan ba, para maipa-check up din yan kung hindi man yan severe or very easy lang matreat yung sakit na meron ka. So, ayun lang. Symptoms to look out for include pag nakakaramdam ka na daw ng pain or tenderness, discharge, persistently red eyes, sensitivity to light. If your child or baby shows any signs of having an eye infection, take them straight to a doctor. For the bottom line, eye infection symptoms often go away on their own in few days, but seek emergency medical attention if you have severe symptoms. Pain or loss of vision should prompt a visit to your doctor. The earlier an infection is treated, the less likely you are to experience any complications. That's all. Thank you and God bless everyone.